Hello, Miss Yasha. How are you?
Hello.
Hi. Congratulations on the birth of baby Joshua here. My name's Allie, and I'm just going to be giving you a little bit of discharge teaching today regarding baby Joshua. So first off, we'll just start with you, and we'll talk about things to care for you, and then we'll talk about how to care for baby Joshua, okay? So I do have a pamphlet here, and I will be sending this home with you because I know this is a lot of information for you to take in right now, and of course you're just worried about baby Joshua. So you'll get all of this, but since you did have a vaginal birth, some bleeding is going to be expected, of course. So it is normal to experience some bleeding, but after the first few days, it should start to kind of lighten up. It'll change to a pink color. And then eventually you should stop bleeding, and it may turn into like a white discharge color, and that could last for like 8 weeks after delivery. So you just want to keep an eye on your bleeding. Look out for any large clots. You don't want anything larger than like a golf ball or anything like that. Check out for any like foul odors that are present. And if any excessive bleeding, or if you're worried about it, feel free to follow up with us. We're happy to see you. As far as your peri-care, we do want to make sure that you use warm water and use an antiseptic to clean it. You don't want to be rubbing the area. You'll be blotting it, and you'll blot from front into the back area. So to help with pain and to keep the area clean, a sitz bath is recommended. You can do either a hot or a cold sitz bath. You can do that up to 2 times a day, and maybe like 20 minutes or so would be good. As far as breast care, you do want to make sure that you're wearing a well-fitted bra, nothing with underwire, and you want to do that for at least 72 hours after you've given birth. Make sure you're checking out your breast for any tenderness, swelling, any excessive pain, any cracks. You do want to be checking the nipple care and make sure that we're looking for any clogged ducts. You can see if you have any different colored discharge that you're concerned about. Please do follow up with us. Medication-wise, we do want you to continue taking your prenatals. Those prenatals that you've been taking, you're going to keep on doing those for about 6 weeks. And we may or may not send you home on some pain medication. We can speak with your physician, your provider about that. But depending on the different medications that you'll be sent home on, that will indicate whether you should be driving or operating any heavy machinery or anything like that, but we can get into it. You'll also probably be sent home on a stool softener, and that's just to help with any straining and prevent hemorrhoids or anything else occurring. As far as activity goes, we do want you to go ahead and get started on your Kegel exercises as well as your pelvic tilt. You used a lot of these muscles down here, so we want to strengthen those muscles and strengthen your core again. So for the next 2 weeks or so, make sure that you're not lifting anything too heavy. So a lot of times we say like 10 pounds or nothing heavier than your baby or your baby in your car seat. You don't want to be lifting anything heavy like that. And again, that's just to, nothing strenuous at all. You just push this baby down your birth canal. You did a lot of hard work, Yasha. So, you know, we don't want you to be doing any heavy lifting. And as far as sex goes, we do want to make sure that you're not putting anything in your vagina. So that's going to be no douching, no sex, no tampons. If you do have bleeding, please just use a pad. We don't want you putting anything up there. I did talk about driving for you. For the next 5 to 10 days, please don't drive a car. A lot of the muscles that you use here for birth are the same muscles that you use for picking up your feet and putting them on the gas pedals and things like that. So you're on Uber duty for the next 5-10 days, but maybe not with your babe. And then of course, if you're on any of the heavier pain medications like the opioids, those would be the standard precautions to not be operating any sort of machinery with those. You didn't have a C-section, so we're not going to go into any of that, but